Dr. Leigh, we talked about missing teeth, and you explained very well how they can affect life, more than just the missing tooth, but, because most likely it's not cosmetically if it's in the back, but how people can get headaches and shoulder pains, and maybe because of it, yes, can lose other teeth also over a long period of time, and then, of course, it's a major problem for other things, and now it becomes expensive. You explained that very well. Also, that it's sometimes not always happening, and it's not always a super fast emergency, and one can plan for it financially and otherwise. So let's assume we get ready to replace such a missing tooth. What are our options? How has technology improved there? Let's just say from my father's days, or even grandfather's days. Let's just take my father's days. Let's not go so far back.
Sure.
What options do we have here?
Depending on where the tooth is located, we can replace the tooth with a dental implant. That's generally the most conservative option. It's the benefit of doing an implant is you don't have to really. You're just working on the site where the tooth is missing. Whereas if we did a bridge, you have to cut the teeth down on each side of that missing tooth, and we try to avoid that as much as we can. So we actually place a lot more implants than we do bridges. Another option.
Interesting that you say a implant, where you put like basically a titanium screw in the bone. I'm probably using the wrong terminology, but
that's correct. Actually,
that sounds very invasive. That doesn't sound so conservative to us. But now that you mention that because of it, you're leaving the teeth adjacent to the hole intact, and don't grind them down and do all kinds of things with them. Actually, that particular action is more conservative than the old way where you have a bridge and ruin other teeth next to it in order to hang the one in between. Interesting.
That's right.
Interesting viewpoint,
yeah.
and quite, I can see it.
Yeah. Yeah, when you're cutting a tooth down, it's live tissue, and there's a blood supply and a nerve supply to that live tissue, which is the tooth, and it just puts it at risk, and it's an avoidable risk at this point where we don't have to worry about these teeth needing root canals later on. So.
Got it. Now, what is that information out there already due to the lengths of how long? Implants have been around 25, 30 years, but they've probably improved drastically lately. And tell us a little bit about it. But is there some data out there of how long does an implant last versus, let's say, a crown? And of course, everything is a little bit dependent on many, many factors. We got that. But a good yes, implants most likely will last you for 20, 30, 40 years, basically forever, and a crown lasts you whatever. Is there some information out there, something we can go by?
Sure. The ADA states that the average lifespan of a crown is 10 years. Considering a dental implant over a bridge, an implant is a one-time procedure. So if it's treatment planned properly, that implant can last you a lifetime. Whereas that crown, you've got to be replacing that within 15 to 20 years max. Generally I've seen crowns last 20, 30 years. I've seen them last 10 years. It really depends on how well they're maintained and taken care of. It's actually much more technique sensitive to do a crown than to place an implant. So again, the implant will last you a lifetime if it's diagnosed and treatment planned properly.
Right. So basically, you might have to do this crown, this bridge, really, because
the bridge.
You might have to do that at least one more time, and then there may be a chance that at that point, because when you grind these teeth down and they start getting bad. Now you might have to do many more teeth afterwards,
right.
or
Exactly.
you might have to do 3 implants anyway, whichever way it is, right? Because you ruined. Is it true that because of the grinding down and because of, in fact, somebody told me that bridges develop easier gum disease due to the difficulty of hygiene? Is that true?
Right.
Well, why is that?
Yeah, well, food collects, and if the patient is not very vigilant regarding keeping it clean, it's easy to get decay underneath the bridge or periodontal infection, which weakens the bone that's supporting that tooth.
I see.
Sure.
So, I mean, you do need to do dental hygiene whether you have your real teeth, whether we have implants, or whether we have a crown.
Right.
I mean, a bridge. But obviously the bridge is kind of one piece. It's almost 3 or 4 teeth welded together, right?
Yes. Yep.
And so in order to clean them, you need that thread flosser and stuff. So yeah, I mean, my wife and me, when we go to the bathroom, doing our thing, I finish shaving, brushing, showering, and she's still brushing. So I would probably be one of those guys who kind of like would slightly, I would like sometimes say, today, no, I don't go on dates. Today I just,
Right.
And then next thing you know is I would have a gum disease. And in other videos you explain that gum disease has a whole host of, it's bad.
Yeah.
Gum disease due to the body. Never mind that you then lose the teeth. I got it. So let me ask you, the price of a crown of a bridge, let's say 1 tooth missing, so you have a 3-unit bridge, as you guys call it, I guess, right?
Yes. Yep.
The price of such a thing versus a 1 implant, is there really a huge difference?
It might be maybe $500 to $800, which to me over a lifetime, it makes sense to do the implant. It's a negligible cost over the lifetime of the patient.
Right. Okay, well, wonderful. Here you have it. So basically, both of them do the trick. No matter what, if they do something. But obviously, why wouldn't we use something new? I mean, if a car comes out which is more crash safe or more whatever safe, we'll take it, right?
Absolutely. Yep.
So makes a lot of sense. And let me ask you, once you have such an implant in it, is it strong? Can you bite on it? Can you chew?
Oh yeah, absolutely. Yes, absolutely. But again, I mean, how did that person lose that tooth? Because that has to be addressed also, because if you're not getting to that cause, then you could potentially have a problem with that implant, which is why we always have to find out the cause first, so that when we treat the area, it doesn't happen again.
Right.
So, but yes, the implant is just as strong, if not stronger, than a natural tooth. Absolutely.
Maybe the government and the bank should figure out what caused something so that we can treat it the right way, the way the finances are going. That would be a good thing to do, maybe. All right, I got that. Thank you very much, Dr. Leigh.
Sure thing. Good to talk to you.